Let me start the topic, and the topic is engineering and administrative controls, as I have said earlier too. So the scheme of presentation in this today's discussion is, we will see what is the hierarchy of controls. I mean, there is a concept called hierarchy of controls, which essentially covers various methods of control when we are trying to manage a particular hazard. So we will look at this hierarchy of controls, and then we will look at the engineering controls and the administrative controls. So this is a graphic that explains in a fantastic details as to what is the hierarchy of controls. Now, if you see, this is looking like an inverted pyramid, and the bottom of the pyramid you have something what is called PPE. And as we go upwards, the pyramid base continues to widen, and this essentially shows that at the top of it there is the method which is on top is the most effective method, and the method at the bottom is the least effective method. Now we will see what are the situations where each of these methods can be applied and where each of these methods can be made effective. So it is important to remember this hierarchy, because when we are designing controls in our hospitals, for example, you are making an infection control program where you want to have some control over the environment within the intensive care units or the ICUs, where you want to apply these controls so that the hazard of infection is either reduced significantly or is completely eliminated. Now, these control systems are applicable to just about any kind of hazard. Today we are talking only about the infection control. So it begins with the PPE at the bottom. Then we have administrative controls, which are slightly more effective than PPE. Then we have engineering controls, which are even better than the administrative controls. The next is what is called the substitution, where we remove the hazardous material and use something which is not hazardous. And then the top is the elimination, where the use of a certain item is, or certain procedure, or a certain method, or a certain object is eliminated altogether. So I will give you an example of the top and the bottom, and then we will proceed with the presentation. So PPE, I think all of us are aware that PPEs are in widespread use in the hospitals, and we all think that PPE is the solution to all infection control issues, whereas it is not. The example of elimination of a hazard is something like use of mercury in the hospitals. You remember we had the thermometers, the BP instruments, and many other things which contained mercury, and then these were eliminated altogether, and we have an alternative technology available. So this elimination is something where the mercury has been removed from the setting altogether, and therefore it does not pose any hazard anymore. Whereas in all of the methods, we are either reducing or we are replacing the hazard. So this is how it is to be understood. And now we will look at the next slide. So the control methods at the top of the graphics are potentially more effective and protective than those at the bottom. I have already said that. Following this hierarchy leads to the implementation of inherently safer systems, so the risk of illness or injury is substantially reduced. Preventing through design encompasses all efforts to anticipate and design out hazards to workers in facilities, work methods and operations, processes, equipments, tools, products, new technologies, and the organization of work. So this particular method of handling hazards through design is something that is in widespread use, and we need to understand how it works. Let me give you an example of the computers or the PCs that we are using nowadays. So all of you would have noticed that you cannot connect one type of a connector on a computer to a wrong port. For example, a USB-C connector will not go into a USB port or USB-A type port. You cannot put a power jack into any other socket. You cannot put a card in the card reader slot. You cannot put anything else. So this is essentially prevention through design, where the design of the product or the service or the item itself is made in such a manner that the wrong connections are impossible. Now compare this with the manifold or the multi-flow that we use in the hospitals, where a patient gets multiple connections of the IV lines. Now all of them look possibly same, and therefore there is a subject in the quality systems or in the accreditation as well, where we are trying to figure out ways to make the tubings connection safer. So this is a contrast where by design some hazard of cross connection or the wrong connection has been eliminated in one kind of situations, whereas for all other situations or many other situations this is not so. So prevention through design is something that needs to be seen. For example, if you have encountered, let us say in the hospital lab, if you have encountered that the door opens both ways, and therefore there are multiple accidents, people getting hit by a door open from the other side. You can have a door which either opens only in one direction or it slides. So these accidents will get prevented. I mean, this is a very simple example. You can have many other things. For example, if you want to stop entry of ferrous metal into the MRI chamber or where the MRI is, then you can have a metal detector installed in the gate or entry point itself, where it will detect whether a ferrous metal is or a metal is going inside. So these are the ways where the design can help us in eliminating or designing out hazards. So in the context of infection control also, this is something that can be used. We will shortly see how it is to be done. So most effective are reducing hazards and also most difficult to implement in an existing process. Because when you want to reduce the hazards by elimination or by substitution, then you need to find an alternative. Either an alternative technology or alternative means or an alternative material, and then and therefore this can become very tricky and very difficult, because many times there may be simply no other alternatives. At the design stage, elimination and substitution of hazard may be inexpensive and simple to implement. For example, when the air conditioning systems are being made, when you have the HVAC in the air conditioning systems in the OT, if you have separate AHUs installed for each operation theatre, then there will be no mixing of air, and therefore the hazard of infection traveling from one room to the other will be limited. Now, the cost of installing an AHU in the design stage or in the building stage may be minuscule compared to what the hazards it will pose in the long term for the patients as well as for the staff. The major changes in the equipment and procedures may be required. Why? Because we are trying to do what is elimination and what is the substitution, and naturally we will need to find what is the alternative technology or the alternative material, and this may necessitate using or modifying our equipment in a major way or modifying our procedures in a major way. It may be virtually impossible to eliminate or substitute risks associated with healthcare associated infections, the HAIs as they are popularly called. So we also need to understand that there is no way we can eliminate or substitute something that will totally eliminate the risks of HAIs. So HAIs are going to be with us. We need to be implementing or we need to be instituting other methods of handling this. So next we come to the engineering controls. So these are designed to remove the hazard at source, and therefore it comes, before it comes in contact with the worker. These are designed to remove the hazard at source before it comes in contact with the worker. So these are the methods which are highly effective in protecting the workers, typically independent of the worker interactions. So these since we are we are creating a barrier between the worker and the hazard, so the worker factors do not influence. And if the worker decides to behave in a different manner, this barrier or the engineering control will ensure that his safety is not jeopardized. However, for these making these engineering controls, the initial costs can be high. We will also see some examples as we go along. So over the longer term, the operating costs are lower, but the initial cost of making the engineering controls may be higher. Also, the engineering controls may provide cost savings in other areas as well. So we will shortly see how it really works. Now, some examples of engineering controls is the space design, where we are looking at the space provision for the ICUs and for the operation theaters. Now, per bed space in the ICU is something that is widely available in the literature, and also the space requirements for the operation theaters, various components of the operation theater complex is also available. The NABH has operation theater guideline where it gives the space requirements. Next, we have space between beds. Again, this is a function of total space availability. So if we have space available, one can create spaces between the beds. Ideally, between two beds, there should be a minimum gap of 1.5 meters. Protective environment. So this is an example of engineering control where we create isolation rooms. Now these can be either a positive pressure isolation rooms, or these can be the negative pressure isolation rooms, depending on what is the requirement. That is, whether the patient is the source of or can be the source of infection. And for that patient, we require a negative pressure isolation. And if the patient can become the recipient of infection or is susceptible to infection because of many reasons, immunosuppression or a disease condition, then he may require a positive pressure isolation. And typically, the standard pressure isolation, that means the isolation without any pressure differential, is something which is widely available. Positive and negative pressure isolation are expensive to create. Basic knowledge of the modes of transmission of infection is required when we are trying to establish the engineering controls. I think it is easy to understand this because unless we know how the infection is spreading, we will not be able to create an engineering control to handle that. So, for example, if it is an aerosol or an airborne or a droplet or a kind of an infection, which will be spread through the particles suspended in air or in a similar manner, then we need to have the isolation rooms, which is the negative pressure isolation room, and where the person can be, the protection can be provided. The next example is ventilation for dilution control. So dilution ventilation is key to healthy indoor environment. It is of limited use in the airborne infection control. But typically for that we require the isolation. High ventilation also requires more energy use, and the humidity control issues will always come up when you have high ventilation. For all indoor patient spaces, air changes are defined. So if you look at the HMI guidelines for the hospitals or the isolation rooms for ICUs, wards, the OTs, for all these places, the air changes guidelines are defined. Typically, they are strictly enforced in the operation theaters, where these are of paramount importance, and they are also enforced in the positive and the negative pressure isolation. In all other patient care areas, at least in the current scheme of things, these are not being enforced, though the guidelines do exist. For the ventilation, when we design an engineering system to provide ventilation, which essentially turns the air over inside a room, and therefore it basically dilutes the pollutant or the infectious agents in the air, and therefore reduces the risk, may also require administrative controls to be added. So typically in the isolation room, we put administrative controls in the forms of access control, and we will see many other varieties that as we go along in this presentation. The other example of engineering control is air filtration and disinfection. So you may have a coarse particle control by having a kind of filters. You can have the HEPA filters for even better particle control, and you can look at the ISHRAE guidelines where they provide variety of filters options which can be used for almost every situation in the operation theaters. Here today we do not have the luxury or the opportunity to discuss various kinds of filters. However, the ISHRAE guidelines are very clear. They are freely and publicly available from their website, and these can be used. Another method of disinfection is by using the upper room ultraviolet germicidal irradiation, something what is known as UVGI. Here you have ultraviolet lamps installed in a manner which where the UV radiation is provided in the upper strata inside the room, and the radiation is not allowed to come downwards where it may affect people working in those rooms. So UVGI is one method, and this also is a technique or the method that is installed inside the air conditioning ducts, where it prevents or it improves the infection control. The other variety of engineering controls we have is the access controls. So when you have access control, it reduces the footfalls and also reduces the number of people coming into a particular area. When we have access control, we reduce the particle load because more people walking in and walking out will lead to more particle load and more bacterial load. So this is reduced when you reduce the footfalls. It also reduces the unnecessary traffic. It helps in containing the infection, reduces exposure because people who are not necessary in a certain area do not come there and therefore are not exposed to it, to the infectious agents. Access control also organizes patient flow. So an example here is that if you have a separate entry and exit in the operation theatre complex, then naturally it will make your patient flow and the workflow better. In the CSSD and in the operation theatre, it is in fact not only in these two places but other places as well. So in the CSSD, in the kitchen, in the operation theatre, the quality systems insist on a unidirectional flow. So you move from a contaminated or potentially infectious to clean and to sterile zone. This is the direction. So it is designed to be, or it is desired to be designed as a unidirectional flow because that reduces the exposure. It reduces the potential infections. So the next is again other miscellaneous engineering systems which provide us controls. So you have the sterilization process control, where you have the autoclaves which give you, which plot the temperature graphs, so you know what is the temperature achieved and for how long it was held at that temperature, and therefore by doing this we know the effectiveness of the sterilization process, the steam sterilization process. Similarly, the ETOs, many of the ETOs are automated and therefore the cycles are controlled, and you can have a printout of the total exposure and the cycle times. Packing and storing is also another variety of engineering controls, where we pack the material in such a manner that it does not get contaminated after it has been sterilized, or we store it in such a manner that the post-sterilization storage is safe. Next, another variety is managing the biomedical waste, where we have various methods by which we ensure segregation, methods by which we enforce transportation, and the methods by which the treatment of biomedical waste is enforced. So these are the examples of engineering controls where they help us in reducing infections or protecting ourselves and the patients from infections. Next, we come to the administrative controls. So before I get on this, are there any questions? or we can have the question session at the end of it. Both are possible. Okay. So if there are no questions, then I'll move to the next one. And this is administrative controls. So these are frequently used with existing processes where hazards are not particularly well controlled. Administrative controls and personal protective equipment programs may be relatively inexpensive to establish, but over the long term can be very expensive to sustain. I think all of us who have had the experience with the COVID management in last 1 year, we would have realized that PPE is a huge expense when you apply PPE across the board for everyone. And therefore, it may, at a lower level or in a smaller scale, it might look relatively inexpensive. Thinking that how does it matter if you have to provide extra masks or some number of gloves or caps or like that. But if it has to be applied across the board, then in the long term it can become a very expensive proposition. And therefore, other methods need to be considered. But yes, it is also to be understood that many times we may not have a choice at all. So administrative controls proven to be less effective than other measures, requiring significant effort by the affected workers. But often there is no choice. So this example of COVID-19 pandemic is a live example that all of us have faced. So you would have realized the amount of enforcement which is required to put the administrative controls, for example, asking people to wear masks. This is essentially a behavioral change, asking them to wash hands or sanitize hands, again a behavioral change, wearing PPE. So this requires a tremendous amount of effort on part of the healthcare providers as well as on part of the healthcare organizers. So both these will have to put a lot of work. So what are the examples of administrative controls? So we have the policies and procedures. So by implementing the policies and procedures, we try to control infection. Now, what are the policies and procedures we put in place? So the policies can be in terms of access control, they can be in terms of who can go inside and who cannot go inside. These can be in terms of what antibiotics to use. For example, you have the use of antibiotics or a pre-operation or pre-surgery prophylactic antibiotic use. You will have procedures defined, so you have care bundles, you have aseptic techniques, you have the monitoring systems. So these are the examples of administrative controls. Similarly, you may need to have education and training program for the healthcare providers, repeatedly training again and again in the infection control methods, and therefore this is an example of administrative control where we try to reduce the risk of infection by training the staff. Now, this we all know that training staff can become a very tedious, very effort-intensive, and an expensive proposition in the long run because you need to do it again and again. Now, in this, for this purpose, if you have an engineering control or if you have, let us say, you can eliminate it, then obviously it is much cheaper. But then in the infection controls, as I've said earlier, it is almost impossible to eliminate the risk altogether. Then we have education of staff, patients, and visitors. So not only we need to train the healthcare providers, but also the patients and the visitors in infection control. So you tell the patients that not more than a certain number of visitors can go inside, or you may have a situation. The hospitals typically do not allow things like gifts or flowers in the rooms because they can become the potential source of contamination. Then we can have the healthy workplace initiatives. So these initiatives can be like providing sufficient spaces, having the practices. Now you would have seen in many hospitals you have what is called hand hygiene timeouts. So hand hygiene timeout is an example of healthy workplace initiative where you have a system where at a at a certain interval throughout the working hours, you have an announcement on the in the hospital PA system where someone announces that okay, so this is the hand hygiene time. So this is a method by which you remind everyone that yes, hand hygiene must be performed, and it is expected that the healthcare workers at these hand hygiene timeouts will take 2 minute or 1 minute timeout and will perform the hand hygiene, whether it is hand washing or using the hand rub. So this is a kind of an initiative. Similarly, there can be other initiatives where we create the healthy workplaces. In monitoring of compliance and feedback, this is something which is the inseparable part of every administrative control, because you will need to continuously monitor and continuously track it to ensure that the methods that you have defined are effective. For example, when you have the infection control bundles, you have the COTI bundle, the CLAPSI bundle, or the WAP bundle implemented in the hospital, we all know that these have to be continuously monitored, only to ensure that the systems continue to work and the risk of infection continues to be under control. So these examples we have discussed, the aseptic techniques or the barrier nursing. So this finishes the today's presentation.